We all want to feel supported at birth. In fact, most people want to feel supported during pregnancy, birth, postpartum. Today, I'm going to talk specifically about labor support, what you can expect, what you can ask for, and how to get that when you're in labor. Of course, you're really going to want to learn this from an expert, especially somebody who's supported people in the hospital. I see so many people on these platforms who really have only supported people during home births or birth center births and really don't know what type of support can be offered in the hospital. In fact, I hear them really downplaying how your labor nurse can support you, and that's disappointing to me because there's a lot of support that the hospital can offer you. While we're here, grab my hospital packing list so that you know what to bring to the hospital, because one of the things you're going to want to support you is a phone charger, chapstick, a hair tie. Those are things of support that you're going to want to bring with you. So don't miss that hospital packing list. I'll put the link below. In case we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, plus 3 kids of my own. So I really understand how important it is to feel supported during labor and in your parenting journey. I am here to help support you for your upcoming hospital birth. If that's something that sounds great to you, please give me a follow so that we can hang out for the rest of your pregnancy, and definitely like great content like this so that you can see more of it in your feed. And it really helps our channel grow, which we are really trying to do. And the more we grow, the more great videos we're going to put out. Okay, so what is labor support? In general, it's supporting us through a variety of ways while you're in labor. Emotional, physical, practical support. And it can come from a variety of people. But it's really important that you feel supported, because as a nurse, I have noticed that when you stop feeling supported and you start to sort of freak out, your stress level rises, and ultimately that baby's stress level rises. And when they come out after they're born, we don't need a stressed out baby. We want a cool baby who's ready to take on the challenges of living in the air. So when you feel supported, it decreases your stress level, which I am a huge fan of as a labor nurse. Okay, physical support. That can be things like doing massage, rubbing parts of your body that hurt. In fact, I'm also a believer that a lot of times you don't want the area that's hurting to be rubbed. Like, a lot of people don't like their back rubbed when they're having back labor, but they might like other areas rubbed. Like in the online prenatal class for couples, I teach people how to do hand massage and head massage, because when other parts of your body feel a little bit better, you're more able to manage the pain that you do not want touched. So physical support can be a big one in the online prenatal class for couples, which is the easy way to get prepared for your hospital birth. I actually have a whole bonus natural pain management video where we go over massage, breathing techniques that your partner can do with you, all those different kinds of things. So if you would like some physical support, ask for it in the hospital. See if they have any tips for you. But I think it's best if you've learned in advance, which is why you take a birth class. Okay, emotional support. I think that can both be like, yay, you're doing it, you're doing a great job, being kind of a cheerleader, but also reminding you that what you're experiencing is really normal, because a lot of labor may seem very unnormal, right? You might have changes in discharge. You might just feel miserable, more miserable than maybe you've ever felt during your whole life. And hearing that this is progressing normally versus your body is exploding, which is what you would normally think if you weren't just trying to get a baby out of you, can feel really good. I also think that feeling prepared and feeling confident can be an emotional support, especially when your partner gets prepared with you. So I think that can be a big win. But sometimes if you're freaking out inside, wondering, is this normal? Is what I'm doing normal? Talk with your providers, because they've seen lots of different types of birth, and they're going to reassure you that either yes, what you're feeling is normal, or no, and this is what we're doing about it. Now, practical support. That can range from texting your mom for you, keeping track of contractions, especially when you're at home. I love the Count the Kicks app because it's important to start doing your kid counts at 27 weeks, but you can also monitor your contractions with that. Great one to get on your phone to start monitoring those contractions. What are the things people can do? Now, if you have friends, one of the things they can do is bring in a casserole, because then at least you know that you're loved, right? If there are people looking for ways to support you, tell them to bring in food. Tell them to bring in cut up fruits and vegetables. I think that can be a big win postpartum. Labor support isn't all just about in the labor room. Just knowing that you are loved, seeing those texts of people who are cheering you on from afar can really be helpful as well. And pro tip, don't feel like you need to answer them. If they're like, I bet you're doing such a good job, you're an amazing person, just take that in and enjoy it. Don't feel like you have to respond. As someone who sends those texts to friends, I do not expect a response. Okay, who can provide this type of support? Well, your partner should be the first one that you're looking to, especially when you're laboring at home. Now, you might have a variety of people. You might have a mom and a husband or a boyfriend or a partner who can help you during labor at home. I think it's great to get them prepared. I don't think that this is something that comes naturally, especially to men. It might become more natural for your mom, but men really start to freak out inside. They are thinking whatever you're experiencing is not normal. So getting them prepared is a big win so that they can support you better. You can also look for a doula. Some doulas will come in early labor while you're at home, or they come when you're in the hospital. If you're interested in a video on how to pick a doula, tell me down in the comments. I might be able to make one for you guys. However, I am not in the wish train where I don't understand how expensive doulas are. They are not something that I could afford at my births, and I understand if you can't afford them either, which is why this video is going to teach you how to get support from other areas as well. Now, when you get to the hospital, you're going to have the labor staff there with you. Most likely, you're going to have a nurse that's assigned to you, and you can look to them to provide you support. They can help get you pillows. They can move your bed into an area that's better. They can get you a labor ball to labor on. There's a lot of things that your nurse can provide that can help you. They can also provide emotional support, again, telling you that things are normal. And they do have good tips on helping you cope with the pain with your partner. Now, most likely your labor nurse is not going to be able to just hang out in your room and massage your back. But what she can do is teach your partner how to do it so that they can help you. If you're experiencing specific pain during your labor, tell your nurse and be as specific as you can so that they can provide support to help you with that specific type of pain. When you just tell me you're hurting, it's less easy for me to know exactly how I could help you. Okay, so how do you ask for what you need? You may not be really great at doing that, especially with your partner or maybe with medical staff. First off, you want to be really clear in your communication. Like I said before, the more specific you are and what exactly you need from the staff, the more we are able to provide that to you. Or same thing with your partner, the more clearly you can communicate with them. Now, I think a real pro tip is for both you and your partner to not get your feelings hurt during this. Okay, your partner may have limitations that they can't do. Like, let's say they probably can't rub your back for 2 hours straight, right? Their hands are going to start to cramp up and they're just miserable. So they may need to say, honey, I need to stop for a little bit and get some feelings back into my hand before I can start the massage again. And you need to not get your feelings hurt because we can't expect anyone to massage anyone for super long periods of time. And at the same point, when you say, honey, that is not where I want that massage, I need you to go lower, they again should not get their feelings hurt because they understand that they're not a mind reader. And the more specific you can be, the more helpful they are to you. It is not that you don't love what they're doing. You just want them to do it different. Don't get your feelings hurt, both of you. This is actually something that I emphasize in my birth class over and over because it can be really easy to get your feelings hurt both during pregnancy and labor. And I think the more that you don't get your feelings hurt, the better it can be. Now, one of the things a lot of people talk about online is that they are not interested in an epidural, and yet the labor nurse staff will keep saying, hey, how are you coping with the pain? Are you doing all right? One of the things you can do is say, hey, I'm coping really well, and I would prefer that you not ask me again. And some of you may feel really uncomfortable doing that. As a labor nurse, one of the things we're required to ask about is if you are coping with your pain. However, if you let us know that you do not want to be asked that again, we can chart it and then we know we can skip that line. So establish boundaries with the healthcare team about what you want and what you don't want, and also reassure them that if you get to the point where you do want an epidural, you will definitely let them know. Now, caveat, when you switch labor nurses, they may end up asking you that question again. And in fact, every time we do a full assessment, we are probably going to ask you about your pain level. It's just an important thing for us to know in the hospital. As you can imagine, we don't want to be ignoring people's pain. Let's say you've had an appendicitis. Should we be ignoring that kind of pain? No, it's really important in the hospital that we're addressing people's pain because some people may not ask for the epidural even though they really want it, and we should be asking them if they want it, if it's an option. I think that getting the support you need can really help you have a positive birth experience, but a lot of it is your own support. Are you ready to be flexible? Are you prepared for your upcoming birth? And are you able to communicate with your provider for the things that you need? Now, if provider is an issue for you, it's one of the big mistakes that I see people making during their third trimester. So I'll put that video up here.